Welcome back to another podcast of Heal Without Harm. My name is Dr. Clayton Dir, physical therapist and the one bringing you the truth on the medical system. Today's podcast is actually the number one reason I'm making this podcast is just to help people understand what those weird white domes are on the side of the highway in Wichita, Kansas, along with that pyramid in the back. But for real, this place is called the Riordan Clinic, and I'm with, what is your title again?
Clinical medical director as of right now, yes.
Perfect. Dr. Drew Rose. DO specifically.
Correct. Yes. Yep.
Awesome. So that's who I've got here with me today to tell us everything about the Riordan Clinic, what it used to be, where it used to be, and then where it's headed next. It seems like they're going through a huge turnaround shift, big growth phase coming up. And so I brought him on so he could tell us a little bit about that. Dr. Drew Rose, welcome to the podcast.
Thank you. Thank you so much for having me.
I'm excited to get into this. I really just want to start kind of like I jokingly said with what are these domes?
Yeah.
What is the Riordan Clinic?
So the Riordan Clinic is a functional medicine clinic that has been around since 1975.
Okay.
Dr. Hugh Riordan is the one that founded this. And back in 1970s, he's a psychiatrist by background, did not like all the psychotropic medicines coming out just because of all the side effects. So what he did is actually started nutrient testing all of his patients and started giving supplements and trying to prescribe more lifestyle modifications to get all of the whole foods and nutrients that people need in order for the biochemistry to work. And he noted that a lot of the like schizophrenia, bipolar, the different psychiatric diagnoses, that is, the symptoms essentially abated, if not went away altogether. So it started there. And then what we're well known for now is actually high-dose IV vitamin C, which started with the RECNAC research back in the early 1990s. RECNAC is just cancer spelled backwards. But he ended up, got a couple grants and did a lot of research actually at this facility on cancer and high doses of vitamin C.
So what's an example of that? I get diagnosed with colon cancer. I'm going to come here and just get a ton of vitamin C pumped into me?
Partly, yes. So the way it's made up now, essentially, is we have two naturopaths that do a lot of the oncological things. So integrative oncology is the name of the game. We want to work with the conventional side of medicine.
Which would be like an oncologist?
Correct.
Right? Okay.
Yep. Chemotherapy, surgery, radiation. I mean, it still has its place. You know, I think that's where it gets kind of lost in translation of we try to treat cancer more holistically. We do, but it's integrated with the conventional as well. So
go ahead.
Yeah. So with the vitamin C, that is, what we found actually, well, Dr. Riordan back in the 1990s found that once you have cancer cells grown in a blood agar plate at a certain concentration of vitamin C, the cancer cells stop growing. At a little bit of a higher concentration, some of the cells in certain cases would actually regress a little bit. So they did studies, actually started dosing people with high doses of vitamin C up to like 100 grams at a time. And we now know that the vitamin C is molecularly almost identical to glucose. What happens with cancer is the glucose transporters are upregulated about 40 to 50 times because they're nonstop growing.
Yeah.
They do not.
Consuming sugar to do that, right?
Correct. Okay. So they preferentially, in a way, just by the nature of cancer, actually soak up all the vitamin C, thinking it's glucose. What cancer cells also need in order to replicate more is iron. So these cells will actually or the glucose that is, that the cells take in will interact with the iron and through biochemical pathways create a lot of peroxide inside the cells, and ultimately the cells will then die off.
And that's because you're giving them vitamin C instead of said sugar, or they think they're taking in sugar, they get vitamin C and then...
Yep. Yeah. The side chains off of vitamin C that glucose doesn't have is what makes it a vitamin. So those side chains essentially are what go through the interactions and create the peroxide.
Interesting. Okay. Total side question, but it relates. I hear sometimes people bash emergency packets because they have sugar in them, but then other people say, no, you actually need the sugar to help with like the vitamin C absorption or something along those lines. What am I hearing correct or incorrect in that type of argument?
Ultimately, I don't think you need the sugar for absorption of vitamin C.
Okay.
Yeah, you definitely don't. Ultimately, try to get the lowest amount of sugar as possible.
Yeah.
Just because, today's day and age, there's sugar in everything.
Yeah, you're going to end up not overdosing, literally,
correct.
But like getting it somewhere.
And it's, I think some people have stronger opinions than others. Personally, if that's what works for you and that's how you get the vitamin C in you, like when you're feeling like you're getting sick, go for it.
Okay.
Ultimately, we always point towards whole foods or a quality supplement brand.
Cool. Okay. Sorry, that was a side note, but it's something I've heard, so I would like to clear it up.
Oh yeah, no, it happens all the time.
Okay, so a couple of questions popped up, and I've heard this time and time again in different times, but I think my biggest question is why is this not either more mainstream, or why is this not the initial approach? Is this whole thing of the gut being kind of like the second brain, and the amount of brain either problems or dysfunctions that are actually traced directly back to the gut. Like you said, he started as a psychiatrist.
Correct.
Realized that malnutrition, essentially, in regards of like nutrients, was what was leading to the psychiatric disorders. And I remember hearing of a study that they did with, I don't know how you figure this out, but either a mouse or a rat. They gave or had schizophrenia. They did a bowel transfer to move essentially poop from one to the other, and it actually started demonstrating schizophrenic symptoms once they had the schizophrenic mouses.
I think I know exactly what article you're talking about, because now they're trying to point towards certain kinds of bacteria in your gut that might predispose you to different neurochemical pathways that might predispose you to certain diseases. So the bacteria in your gut, which there's more bacterial cells in your body than there are human cells, which is insane if you actually think about it. But absolutely, the gut is your second brain. In fact, a lot of people would argue that it's your first brain, because the connection between the gut and your brain, just all the different pathways in your body, there has to be a good balance. And if there's not a good balance, then that's where it's a house of cards. Then the cards fall, certain disease states arise, inflammation, whatever it has, or you're not able to absorb the nutrients that you're actually putting into your body.
Gotcha. Yeah, because my thoughts, so I can't stop attempting to analyze everything. And so my first question on that would be like, well, if that's the case, then how are people almost what seems like born with a psychiatric disorder like schizophrenia or OCD or stuff in that realm? And then it makes me actually question, like, is there a predisposal where maybe that person has almost like an increased chance of it, and then with eating habits, it further feeds that dysfunction?
Yeah.
Would that be kind of the answer to, are you born that way or did it develop?
Yeah. Nature versus nurture, right? So I'll go back to the cancer topic on this one, just kind of use as a reference, because back in November, we actually had a Cancer Care Reimagined conference at WSU. Had quite a few people internationally fly in and talk about this. And the reason I'm bringing that up is because you're absolutely right. Is it nature versus nurture? Is it genomics versus nutromics? The nutrient profile of your biochemistry. And what they're finding now is there's a shift of saying that cancer is not a genetic disease. Your genetics can predispose you to the possibility of certain things arising, but ultimately it's the metabolism, and metabolism is obviously heavily dependent on your gut health.
Okay.
So if you're putting in a ton of processed foods, you're not really caring about your gut health or your overall cardiovascular health, all of these different things, then eventually the dominoes are going to start falling one by one. But if you're somebody who is extremely health conscious, eating all the right things, doing all the right stuff, there still is that predisposal with genetics that it still may break through just because of physiologic stress, external stress factors, whatever may happen. And toxins. Toxins actually are a huge thing that we talk about here at Riordan Clinic, because the toxic load that anybody gets just from walking outside and breathing the air. There was an article that I believe the amount of toxins that have increased over the past 100 years has gone up about 2,000%. So we live in a toxic world, and the nutrient profiles, unfortunately, are continuing to downtrend.
So we have a harder battle with less equipped bodies.
Correct. The soil is being depleted. The whole foods are not as nutrient dense anymore, and the toxins continue to rise.
So what are the toxins that you speak of? Because I think a lot of times on social media, which is where I feel like a lot of people get their information, accurate or not, right?
Yeah.
Talks about like how, let's go do this detox, or let me go sweat out all these toxins, or, oh my gosh, that's so chemically filled, that's a toxin. I've heard a lot of things about like heavy metals and like whatever. I don't mean this to be rude, but like whatever that is, like what are some of these things? Let's start with like, I guess, toxins. Like, what are the toxins that you're kind of referring to? Are there examples you can give?
Oh yeah, definitely. And we test for almost all of them. So glyphosate is one of the biggest ones as far as an environmental toxin goes. We live in Kansas. About 3/4 of the state is sprayed in glyphosate. When it's sprayed, especially in the springtime, summertime, I mean, that's carried by air. So you're walking outside and boom, you're exposed to it, especially
very windy here.
Exactly. And God forbid if you're somebody who lives right next to a field.
What about golf courses? Sorry to jump in.
Yep, that's another one. So they very much want the pristine greens and things. So a lot of golf courses are known for being some of the most toxic, dense, I guess, areas, microenvironments, essentially. Other ones, so you mentioned heavy metals, groundwater, if there's been any leakage of any kind of disposal into the groundwater, wells, things like that. Also just going through life in general. So we've all heard about lead paint, lead pipes. There's heavy metals and a lot of different kinds of things, vaccines as well. Some of them will have heavy metals that actually carry the vaccine in. There's also medical tests. So gadolinium is used for contrast in MRIs so that they can see certain tissues that they otherwise would not be able to. And those kinds of metals, some of them are not excreted by the liver or the kidneys.
Okay, so like your body's natural detox can't even
take
care of it, right?
Gadolinium is one of them. It just shows that you've had MRI with contrast before. And what do you do about it? There's certain things we could do from a nutrient standpoint to a chelation standpoint to try to help detox you from that.
Gotcha. So I think with these things, a lot of this stuff can sound scary, right? Like I currently live 1.5 miles from a golf course. My wife oftentimes gets paranoid. I don't mean that rudely, but be like, oh my gosh, our kids are going to have more issues because we live within 2 miles of a golf course. And I feel like some of this stuff we can control and some of it we can't. Like this, I could move, but I'm straight up just not going to.
Yeah.
And I also feel like when it comes to any sort of sickness, whether it's cancer, big sickness, metabolic dysfunction, I view the whole thing as a lottery system that you don't want to win. Like just being human, you've already purchased a lottery ticket.
Yep.
You don't want to win this lottery though, right? If you choose to smoke, you're buying more lottery tickets fairly rapidly.
Yep.
If you choose to do certain things, you're going to buy lottery tickets. And if you make what I would say good, healthy choices, I don't know if you can necessarily get rid of the lottery tickets, but you're at least choosing to not buy more.
Right.
Some people can smoke a pack a day for 60 years. They've bought a ton of lottery tickets, but they somehow still don't win the lottery of cancer. They somehow still don't get cancer. But then you have the health conscious person that keels over at 40 due to a heart condition. That was just bad luck.
Yeah.
Like that's why I view all of it, right? And so like of all these things and all of these different toxins that you speak of and vaccines and MRIs, like some of those things are very necessary.
Oh, absolutely.
And so what do we do about that? Like, is there something where we just are kind of like having informed consent? We know the risks and we choose, the solution anyway?
So let me...
The solution being the tests or...
Yes. So let me use vaccines for one, because that seems to be a hot topic, especially in the past, 10 to 20 years or so. So I'm a DO by background. I'm conventionally trained. I'm internal medicine. That's kind of where I come from. And that's where I've been for the past 9 to 14 years, depending on how you want to look at it with education versus residency and things. So I very much am pro-vaccine, but the thing that you need to know about the vaccines, I think people don't educate themselves on how vaccines are made.
Yeah, they do.
Well,
right.
Yeah.
I'm being passive.
But what else are in the vaccines? Are you allergic? If somebody has a reaction to the vaccine, are you reacting to the antigen that they're injecting into you so that your immune system can build immunity to that certain disease? Or are you reacting to the solution the vaccine is in, all the other things that are in there to make the solution stable to inject into a human body?
Mm-hmm.
So an example I have is like the PPD test, the test for TB. It's just a little wheel underneath your skin. Some people can't get it because they react so heavily to it. It skews the results.
Mm-hmm.
You just have to be educated on that. Vaccines, I believe, have been a necessary part of human evolution, especially. We've gotten to this point where we can expand our life expectancy because we've gotten rid of diseases like polio and smallpox. Those were vaccines and those were based in science. Mm-hmm. So I think, it's just a matter of educating yourself, knowing that you can't do one thing without some sort of reaction. I mean, what is the physicist that says for one reaction, there's always an equal and opposite reaction. Yeah. So what is that reaction going to be so that you can anticipate it and get ahead of it? Mm-hmm. That is kind of my whole thing. Education is key on that.
Right, for sure. I think what a lot of people's challenge is I don't know, I just think everybody has this perspective that the ones doing the educating are heavily biased. And I think that's where then they become skeptical of the educators and thinking that them finding the information on their own is more valid than the one providing the education, like the doctor in specific. And I don't have any solution for that.
I think
than just like having a good relationship with your direct doctor.
Yep.
Right. And then trusting what they say and be willing to have a difficult conversation, challenging what they're saying, but do it respectfully.
Yep.
And ask for more evidence. Because I know how to do research, and I don't even know how to appropriately research the vaccines. You know, what I mean? In the sense of like I've went through the medical system in the physical therapy department, and I know how to read those research articles. And honestly, it's very intimidating to go look up all the vaccine stuff. And so it's like, if I don't feel equipped to handle it, then I feel like the average person shouldn't necessarily feel equipped.
I think there's definitely an inherent mistrust in the healthcare system right now. So speaking of our country alone, not kind of looking at the whole world perspective, but in general, we look to organizations that are otherwise government-funded organizations. Mm-hmm. And with the inherent mistrust of what's going on with the government or whatever your opinions are politically, the pendulum swings so quickly.
And it's only like all the way one way or all the way
other way. And it's almost to the point where it's like we're so far left, we're almost right again, or vice versa. And no one really knows what to do. And it is confounding. I mean, even as a provider here, trying to find quality studies to explain things to my patients and just in general my family even is difficult. Mm-hmm. So it's not just something that's felt by the general population. Trust me when I say it's felt by the healthcare providers as well. Yeah. And it's something that we have been banging our heads against the wall for decades and trying to get some quality studies out there to educate the general population. Mm-hmm. I did COVID all through the pandemic. I was working ICU. So that is a perfect example right there. Is nobody really knew what to do until they came to me. And at that point, we're literally talking life or death. Yeah. And it's kind of neither here nor there at that point. We're going to do everything we can to try to give you as much time or as much quality that you have left. Mm-hmm. So it's something you have to be proactive about. And it's something that you have to be open-minded enough and try to seek out the people who have devoted their life and sacrificed all of their 20s, multiple decades of their life to become these professionals.
Yeah, no, I would agree. And so you talked about the toxins and heavy metals and stuff like that. I think what I've witnessed with the medical system is you have people that are healthy and not having any issues. I would say for me, that'd be me right now. Like, mm-hmm. I don't go to the doctor much. I'd have your occasional cold or sickness, like no big issues, right? Yep. And people my age at my health feel invincible. And then you have our parents who are on 6 medications and maybe doing fine, maybe also struggling, unsure. And then I feel like you have this like huge, and then you have like cancer patients or you have like these very bad off health, unfortunately, that are in the hospital or repeatedly visit in the hospital. And then I feel like you have this like middle ground. Mm-hmm. Like I've got one friend in mind that she's been in and out of the hospital maybe 4 times, 1 to 4 day stays in the last 10 to 15 years. And she's right around 30. And I feel like every time she gets better, but there's never really like answers. And I think that's the spot where it's just like, it's almost like that person's not unhealthy enough to require the life-saving stuff of our traditional Western medicine. Yep. But they're also not healthy enough to be happy and like thriving. Right. Like, what do we do with those people? And how do we help?
You just described kind of the perfect scenario of who I think is one of the biggest targets of people for Riordan Clinic. Okay. It's you said it. It's like you're not healthy enough, but you're also not sick enough to really be categorized in one way or the other. You know, if you hit these road bumps, why are we hitting these road bumps? And that's something where I really feel like conventional medicine fails all of America because you're only allowed 10 to 15 minutes with a primary care provider at a time.
I think average is like 7.
And that's if you're lucky, honestly. I mean, some people I've seen have 30-minute appointments scheduled and they get 7 minutes, if that. You know, and you don't even have enough time to go through the 20 different medications they may be on. Mm-hmm. But these people need some sort of investigative work with somebody who's trained to look into this stuff, to look into your lifestyle, really hear about what possible exposures you might have. Mold is a huge one. Mold is indolent, and mold is something that I think a lot of people, they understand mold, but they don't understand mold of how it works once you're actually infected with it, or if it's overgrown. But I think that's the kind of work we do here from functional medicine. So I think that's where functional medicine is only going to grow for that subset of populations.
Mm-hmm.
The difficult part of that is traditional insurance does not pay for a lot of what functional medicine will do.
Yeah. And I think that's what's super hard is, transparently speaking, like, I would like to start looking into some of these things, but it's one of those things, it's not a big enough problem for me now to invest the cash that it takes to do it.
Hmm.
And I would say I'm not like hurting for money. I'm not like crazy well off. And so then it's like, is spending a chunk of money now going to save me 10x that in the future?
Yeah.
Is spending money now to investigate this going to give me 10 years on my life in 50 years?
Yeah.
And it's not that it always has to be transactional. I don't even expect a direct answer from you on this topic, but I think that's what a lot of the people 25 to 45 are like really questioning, like, what do we do here? And then I'm like, okay, so if we go up the chain to fix that problem, do we go to insurance companies and ask for it? Do we just start changing the healthcare plans that we're on to where I give the insurance company less money so I have that money to push towards someone like yourself? Like, what does that solution look like is what I would ask.
And I don't have a great answer.
Yeah.
Unfortunately, it's one of those ones where on my worst days where I get frustrated with the system, it's almost like, let's just start over from scratch.
It feels like it needs to be that way. Just like, recreate the whole system.
It's right now, there was a hearing in Congress actually about them talking, I can't remember exactly who the representatives were, but they were talking about how the insurance companies own everything. Mm-hmm. It's not even like doctors are able.
There was a gal talking
CVS,
about CVS.
Yes.
They literally owned
everything from beginning to end of life. It was like, they owned everything.
Like the doctor's offices, the pharmacy branch manager. I think even the vaccine something. I mean, and I may be wrong in the last part, but it was literally everything. They're like, okay, now you need to go buy this, and it's like, plot twist. They own that too, and they own that too, and then they own that too, and it's like, literally, it doesn't matter which one you go to.
So then they could set the price for the different tests that you need to have, and they can inflate it as much as they want because they say, this is what you're going to get. We also own the insurance you have, so we know how much we're going to reimburse. So you have to go do this because you can't go anywhere else. Yeah. Same thing with medications, life-saving medications. Mm-hmm. And these companies get to dictate that. The biggest thing that I feel a lot of people are missing from the general public standpoint, a lot of physician groups actually now are owned by insurances. Insurance has gone around and actually bought out a lot of the larger physician groups. So I'm not there anymore, which is thankful. Even my prior job is not involved in this, which is great. But it's something that I don't ever want to get involved in, because if I were to go be a primary care provider for an entity that is owned by some place like CVS or something, the amount of time I spend with my patients is not dictated by me.
At all.
What I can do for the patients is not dictated by me either. In order for me to get paid and be able to put food on my own table, I have to do what they're telling me to do. But they're basically just using my credentials in order to push their agenda.
Yeah.
So doctors are no longer the ones who are in charge. They haven't been in charge for decades. We're employees that are buried in 400, 500, sometimes more thousands, like $100,000 of debt. I personally graduated with $450,000 in debt.
Dang.
I'm still paying this off 10 years later.
And when you're buried that deep, you take what you can.
You have to.
Least, that's what the average person's going to do.
You need a job. They basically put you into poverty and in indentured servitude, essentially, so that you do whatever they want. And you have no choice because you have to make ends meet.
Yeah. And because you hold this prestigious degree on the wall, like, it is known that your opinion carries weight. Unfortunately, your opinion is also like filtered.
It's bought and paid for.
Yeah,
essentially.
Honestly. And I think that's what I found is, I jokingly have said, when I bought my first house and then started looking to buy a second one later on, and then everywhere in between, if you want to see people fight for someone in their life, ask who their realtor is.
Yeah.
And they're like, oh, you've got to use my realtor. And it's like, why is that of all services, like the ones that people are like, no, you have to use mine. It's like, you should care that deeply about your doctor.
Yep.
And like, once you've and search and go find the one that's worth like fighting for like that, because they're hard to find a lot of the times. Generally because they're unable to get out of traditional clinics that are owned, mostly from a financial perspective. Like, if you're with $450K in debt, I think the average PCP, primary care physician, makes $200 to $250 maybe a year. ish, right?
Yeah, that's a
that's
good estimate.
Nearly 2x your salary.
Mhm.
And it's a big salary.
Yeah.
And so somebody who's making a lot of money, relatively speaking, is still like hands tied. Like it's like
Yeah.
golden handcuffs. Like, well, what am I supposed to do? And then you want to go start your own thing. It's like, cool. Now you have $450,000 in debt, and you're gonna like go start a business. Like,
Yeah.
taking on more debt.
Yep.
Like that's really frustrating and challenging. And so what I found, there's a guy that I follow on TikTok that I just found, and he used a quote that I've used before that I got from some really smart person. And the tune of it is, if you cannot fix the system, then you must build a better one.
Yeah.
Making the old one obsolete.
Yeah.
And I think that's what people like you and I and many more are starting to do, just to essentially like leave that system and let it crumble upon itself.
Oh, absolutely. That's the biggest reason why I'm at the Riordan Clinic now.
Mm-hmm.
It was always in the cards for me to transition to more of a wellness, preventative healthcare, functional medicine, whatever that would have been. I kind of thought I would be doing that in 2027. This job opportunity came up a little bit quicker. It's checked every single box for me, which is why I'm here now.
Mm-hmm.
I never actually thought I'd be living back in Wichita. I'm born and raised here. I was gone for 14 and a half years. I'm now back in Wichita.
Yeah.
I'm a Wichita boy again. And it checked all the boxes.
Mm-hmm.
If I joke and say that from a value standpoint, from the osteopathic philosophy, because I am an osteopath through and through. We believe, 4 tenets of osteopathy. Every person is a unit of body, mind, and spirit. Is structure and function are reciprocally related. So if your structure's off, your function is going to be off. And then the body has self-healing and self-regulating systems, and then treatments based off of those. That is what I want. That's the kind of doctor I want to be. But unfortunately, being in acute medicine, being on the conventional side, your hands are much more tied. Riordan Clinic, being a functional medicine clinic, having the integrative oncology here, being able to work alongside naturopaths, which a lot of people still don't understand what they are, it just fits right with my own value system and for what I want for all of my patients. So it's been a great transition, and I think trying to demystify the domes and everything off of K96 has been kind of a personal mission of mine.
For sure. And I think it's a great one. And I want to take this moment to say, if you're listening now, supporting people like Dr. Drew and me and other providers like this is the way that you can make the difference ultimately on helping us create a better system.
Yeah.
Because like we can't keep doing this if we don't have money coming in.
Right.
Because the money is unfortunately going to still be sent to the big companies of insurance and those corporate ran doctors' offices and stuff. And so by helping prop up the new and upcoming ones that are putting you, the patient, first, ultimately, is going to be the path moving forward.
Yep.
And it is scary, I feel like, as the consumer, because we're like so conditioned in a certain way to like, oh no, I'm supposed to go to the doctor for that. And you're like, why? And it's like, I don't know.
Yeah.
That's just what we're supposed to do, right?
Yep.
And it's like stepping outside of that is different just because it's not the norm that your parents did or your grandparents did. But when you start to like feel listened to, and when you express your concerns, and Dr. Rose here can like actually be like, yeah, the research shows blah, 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 blah. And here's the explanation for why you feel this way.
Yep.
That feels pretty dang good. And so I do want to get into that now. So we've talked about heavy metals, mold, which I'm also kind of curious if like that's the new epidemic, because all these old homes and buildings, like I'm hearing more and more people who either live or work in these old buildings like, oh yeah, it's getting cleared out of mold now. And this is why I've been coughing for the last 6 months. So tell us a little bit about how you would go about like testing for these things.
Yeah. So I'll just kind of take you through if you're a new patient. If you call, you're looking to maybe come in, get some more answers. You'll talk to one of our new patient coordinators. They will kind of explain the whole process to you, figure out what line you need to go down. Obviously, we have the oncology line that you'll be paired with a naturopath. And then chronic complex disease is something more that Dr. Ron and myself actually go down. Dr. Ron Hanihaki has been here for 38 years, since 19, whatever that makes it, late 80s, early 90s.
86.
So, I mean, he's got 4 decades worth of knowledge on this kind of stuff. We will do everything from chronic fatigue to people who have been around, healthcare providers and can't get really a diagnosis or understand what's going on with them, all the way down to the basics. You just want to get executive wellness and check out what your nutrient profiles are. So typically what will happen is you are scheduled a 90-minute intake. How many times you sit down with an actual physician for 90 minutes to tell your story? And then we do have lab profiles. This is typically the most expensive part of things. A certain subset of people, you can actually charge the labs to Medicare for reimbursement, but most people it's out of pocket. But these labs will go through and test all of your vitamin levels, all of your mineral levels, all of your amino acids, all of your fatty acids, which is a huge profile people underestimate. All the way down to your methylation cycles too. Are you processing things appropriately? Do you have enough glutathione in your body to actually detox yourself? And then if you want to get down to mold, other toxins, environmental toxins, heavy metals, we partner with other labs that are relatively local, Mosaic being one of them up in Overland Park, where it's a urine test and we can test for mold, heavy metals, other kind of environmental toxins. So functional medicine, the foundation of functional medicine is the laboratory testing, because we want to see what's going on with you from a biochemical level all the way up.
Which makes sense to me, because I think the way I operate as a PT is I'm not going to give you generic things because of, like your hip hurts. And a lot of people, I think, ask for that, especially through social media. It's like, my hip hurts, what should I do?
Yeah.
I'm like, that's like saying, my car is running a little loud. What should I do, mechanic? It's like, well, let me, I don't know, diagnose it, look at it, test some things. And so it's like when people come into my office for PT, I'm looking through like what is strong, what is weak, what is mobile, what's not mobile. Like, here's where we see the problems, and guess what? Here's a solution for each one of them.
Yeah.
And the way I understand what you're saying is like, let's go actually take a look under the hood, look at all of these things and say, this lab is off, this lab is off, this lab is off, which coincides with what you wrote down as your symptoms.
Yep.
Here's what going to be the solution. I mean, plain and simple. Is that essentially?
Oh, that's exactly it. It's basically connecting the dots and then taking out the guesswork. Just take out the guesswork. Don't walk into a vitamin store and just randomly grab vitamins because you heard they're good for you.
Mm-hmm.
One, the supplement industry is not regulated.
Mm-hmm.
I would argue that it's almost just as dangerous as the pharmaceutical industry.
Mm-hmm.
So being able to navigate that is a little difficult as well. Let us help you with that.
Yeah.
Don't go just try things. What do you actually need? Because if you need B vitamins, that's great. Take a B complex, but if your methylation cycle is off, you need the methylated versions of the B vitamins in order to absorb them and utilize them.
Quick question on that. Why not just everybody take the methylated ones?
They're a little bit more expensive, and it's not as you don't need to. Let's just put it that way.
Yeah.
I mean, it's one of those things where if you have like an MTHFR gene mutation, taking the stereotypical B complex or so, you could absorb them, but you're not going to be able to utilize them.
Gotcha. You
could use methylated versions, which is fine, but they are going to be about 2 to 3 times more expensive. So, and it can get expensive. So, you got to be fiscally responsible as well.
That makes sense. There's something else I wanted to ask on the blood labs aspect. Okay, so I come in and I get blood labs. What's the next step? So I see you for an hour and a half. We talk about, here's my problems, yada, yada, yada. Like, cool, let's run through these blood labs. They come back. How quickly do they come back? And then what do we do next?
Yeah, perfect follow up to that, because it does take about 3 to 4 weeks for your labs to come back. Most of them will come back within about a week to 2 weeks. Some of them we have to send out. We do have a biosciences center lab here that does most of the testing, but some we still do have to send out, wait for those. And especially if you do like the specialty testing, like the urine test we talked about that we have to send up to Kansas City, we have some that we have to send to Chicago. So that's where the time constraints come in. Typically, I'll follow up with you about 4 weeks after our first appointment. It'd be a 60-minute follow-up. And that whole 60-minute follow-up is going through your lab so that you understand what's going on as well. And then I'll give recommendations as far as what supplements may be beneficial, or where we need to tackle things, whether it's inflammation, whether it's building up your amino acids, whether it's, fixing your fatty acids, which is very common, especially in this part of the world. We go through everything together. Typically, after your first appointment, we do recommend get a nutritional IV. There's IV spas everywhere these days, right? Go get a Myers cocktail. That's a nutritional IV. We do the same thing here. I'd say the reason we're different is because we've been doing this for 50 years. So the formulations we have proven that they're the osmolalities are all balanced appropriately, that your body's going to absorb things a lot better. We have different ways we can add different electrolytes. We can kind of alter the different nutrient profiles. We could also give you just high doses of vitamin C or other kinds of IVs as well. So once we know what your problems are or where your deficits are, it kind of opens the gate to all of these different therapies that might be beneficial to you.
So I know we talked initially about nutrition and stuff, and then the next thing you mentioned, like we're talking about now, is IVs and supplements.
Mm-hmm.
Is that what you recommend? I don't want to say for everybody, but or how much is the discussion still back to lifestyle, right? Because in my eyes, I would want everybody to fix things or know what to do and then change their lifestyles to fix it and not require supplementation and stuff. I understand it doesn't always work that way, but what kind of mix do you have on like, what do you eat every day? Like, how much do you work out? Like, do you work out? What is your active lifestyle like? Like, how much are you spending time on like lifestyle as opposed to just supplementation or IVs?
Oh, I would say at least a third of it.
Okay.
It's definitely a big part, and it's a huge conversation we have within the 90-minute intake as well. And right there, I can give recommendations on what to change, what to work on between our first and second appointment. Mm-hmm. Diet is massive. It is huge. Understanding how to even go grocery shopping is the whole conversation in and of itself, let alone mobility and how much movement you're getting. What kind of movement are you getting? And then all the way down to, do you have some sort of spiritual practice, some sort of mindfulness? What are you doing to nurture your mind and soul as well? You know, those are just as important as to what are you doing for your body.
Yeah.
So I do have that conversation with every single patient that comes through. And then give recommendations if, little things. You got to start small. You cannot start big.
I used to try. I agree.
Yeah,
it doesn't work.
It doesn't work.
You need to do all this stuff. And they're like, yeah, I'm not coming back.
It's great for like 2 weeks or so. And then people fall off after about a month or so. And it's the same thing with like New Year's resolutions. And you probably see it too. Mm-hmm. Huge resolutions, going to change everything January 1. By February 1, what's the statistic? Like 90 or 80%?
I think it's the second Friday, actually. Like
not even February 1st?
January 1. So if it's like January 1's on a Wednesday, it's like the second Friday, like a good chunk of people have already fallen off.
Oh, I was trying to give the benefit of the doubt there even. Man, see?
Jump to the next
so
one.
You have to start small. Mm-hmm. Small changes build up over time and create huge change in the long run.
Yeah.
So education, little tricks like that are going to be huge.
What are some of those like nutritional changes that you'll recommend? Like if you just had to be like, oh, here's the 2 most common things. I always tell everybody to blank with their diet. Like,
Whole foods. Whole foods in and of themselves is going to be invest in the organic, as organic as possible. Meat is a huge one. We live in Kansas. Everyone loves the red meat. Mm-hmm. Don't eat red meat every single day necessarily. If you do, go for anything that's grass-fed, hormone-free. Try to stay away from anything that has antibiotics and hormones consistently on the label. Mm-hmm. Poultry is really bad about that too. Trying to find poultry that is not filled, essentially. Yeah. So I always tell people that in and of itself is worth the investment. Go spend the extra 50 cents for the apples that are not sprayed with all these different harsh chemicals. Also, washing your produce.
Yeah.
Knowing how to wash your produce. Don't just go home and start popping those grapes or anything. Even just a simple baking soda bath for 15 minutes will actually deactivate the vast majority of any insecticides and pesticides that are on the produce itself.
Gotcha.
So that there's just small things. Those are the 2 big ones that I always tell people. When you go to the store, try to get as much fresh whole foods as possible, as organic as possible. Stay away from any antibiotic and hormone heavy meats, that is. And then if you're still trying to go for, what am I trying to say? Like, fill your freezer, essentially. Go for the whole foods that are flash frozen. Don't go for like the fruits and vegetables that are, I don't know. You just got to read the labels. That's the big thing.
For sure. And just become educated and learn alongside.
Yeah.
Okay. So the next thing I want to get into, you've touched on it here and there. You talked about, I think, the 4 pillars of osteopathy.
Yep.
Talked about if your structure's off, like your function will be off and all that kind of stuff. So As a DO, what is this OMM, osteopathic manipulative medicine, right?
Yeah. So I actually did a fellowship of specifically on this. It's a teaching fellowship in medical school, spent an extra year, and actually had the fellows had their own clinic. But it's osteopathic manipulative medicine.
And this is not something that every DO has.
Every DO learns it in medical school. Less than 10% continue to practice it outside of medical school.
Got it.
So it's one of the major differences between MDs and DOs now. The accrediting bodies that overlook medical schools have essentially unified the curriculums. But DOs get 500 extra contact hours for manipulative medicine training. And this goes all the way back to Dr. A.T. Still, who founded the philosophy of osteopathy. Fun fact, he's a Kansas boy as well. So what it comes down to is we learn how to manipulate the body similar ways that chiropractic does. Chiropractic actually was developed parallel to Dr. A.T. Still around the same time, only 500 miles apart up in Iowa.
Gotcha.
So it's crazy. It was Dr. Palmer and Dr. Still probably 12 years apart, 500 miles apart, and that's it. But manipulating the musculoskeletal system so that everything's aligned allows better flow from the arteries and veins. But where we start to kind of branch off from chiropractic is DOs learn how to manipulate everything from the organs, the fascia, all the connected tissue. We also have courses where we can get a little bit more in depth, but we have cranial osteopathy, where I can manipulate the bones and the dura in your head. I can manipulate the fluid flow from the cranium down to the sacrum. And then there's even a biodynamic portion of that. So kind of go back to the whole body, mind, and spirit. Body is the basics that you learn how to manipulate. Cranial kind of has a lot of implications for not just overall body health, but in vitality, but it can actually help with a lot of like depression and anxiety and things like that to kind of help balance the nervous system. The biodynamics is more of the energetic portion of that. And it's not directly taught in medical schools, but there's courses you can take outside of medical school that's very osteopathic based that get pretty heavy in the biodynamics.
And when you say energetic, you're not talking about being like full of like energy and like caffeine ridden, but it's more of like, where's the energy in your body?
Yeah.
Almost
so
I don't mean to insult if this comes off this way, but like I know acupuncture will go off chi and the flow of energy. And then I know there's also like Reiki that will talk about energy. Like this is all at least like in the same realm.
Yes.
In regards of like what we're talking about when we say energy on that aspect.
It actually is. And there's, trying to stay as scientific as possible. There was a belief that even the bones in your head do not move because of the way the sutures ossify over time. Mm-hmm. The sutures in the head will kind of ossify like this. NASA actually did studies. It was not particularly for this, but it actually incidentally proved that the bones in your head will move up to 3 millimeters at a time.
Which, fun fact, is the same amount the SI joint moves.
Yes, it is. So
which actually is kind of wild to me. I didn't know that.
It's it's actually a big motion once you actually understand that.
Yeah.
But there's also studies out there about the energetic, like the EM field every single person has off them, about 18 inches off. You can measure that EM field.
Interesting.
Yeah.
I mean, I feel like it's one of those things that it makes sense that stuff like that would be there. And one thing, I remember there was this, you can't even call it a study. It was like one dude that was measuring the weight of people when they died.
Yep.
And 6 people he tested, and all 6 of them lost. I don't remember. It wasn't much.
It was a fraction, but it was a significant.
The second they passed away, it was like, and then like they were lighter. And I'm like,
yeah.
And I think he theorized that their soul had left their body and like that had mass. And then you can get into like the conversation on like quantum physics. And it's wild.
It's a rabbit hole. Those are the rabbit holes nerds like me go down at night. So absolutely, yes.
I totally get it. Okay, so osteopathic medicine. Yeah. There was one other question I was wanting to ask on that realm. I lost it. No worries. Okay, so I actually do have a client of mine that I will probably have her come in here because what I've noticed is some of my favorite patients as a PT is the ones who have seen 5, 10, 15 providers and never got answers.
Yep.
And at least in the musculoskeletal world. And so I've got somebody in mind that I'll probably actually talk to you about after this and get her sent over here because she feels this goes back to that limbo. Like she's still living life. Like she can shovel her driveway and like she did all of her stuff. She still like does the workouts that I ask her to do, but I'm really happy in regards to like how she feels. And she's even had a couple surgeries to like help with this. It didn't. And a lot of it has came back to what she described as like, I just feel tight and tension. And I'm like, this doesn't make sense. Like when I will manipulate that tissue with my hand, she's like, it doesn't really change it. I'm like, so then it is tight or it isn't tight? And I'm like, I know I'm missing something.
Yeah.
And the description that I've given people that I found is there's a lot of times people will have a hip issue, a knee issue, or a shoulder issue that is like so obvious and clear as day to me, but no one else has seen it.
Mm-hmm.
And what I found, and I don't think I'm this like almighty anything. And I'm just like, this is so straightforward. Glute tendinopathy. How did all these people miss it? And I know when I can't figure something out, I need to find the doctor that's going to do what I just described to that thing. Like,
Yeah.
they're going to be like, oh, you have blank, blank, blank. Oh, that's so clearly like this diagnosis. I'm like,
Yeah.
well, I just need to get you in front of the right person then.
Yeah. And it's everybody looks at things through a different lens. It all depends on our background, our education, our experiences in life.
Mm-hmm.
So and that's why I've always gone down to saying medicine is a team sport.
Mm-hmm.
It absolutely is. And it's not one person. There's not one person and there's not one thing that can cure any kind of one disease.
Mm-hmm.
So it takes a team.
No one system is, I remember we talked about this in PT school. It's like no one system is affected. You can't be like, that's a muscular issue. It's like, it might be primarily, but the nervous system is there. The cardiovascular system is there. The lymphatic system is there. I know less about this, but the metabolic endocrine system is involved. Like which one is gonna, and that's why I think too, there was a joke. It said, an IT, it was a mechanical engineer, electrical engineer, fluid engineer, and then a IT guy, like all get a car and it doesn't start. And the mechanical engineer is like, oh, there's probably not a spark. And the electrical engineer is like, oh, the battery's probably not working.
Mm-hmm.
And the fluid engineer is like, oh, there's impurities in the gas tank. And the IT engineer is like, should we turn it off and turn it back on again? Or we should all get out and get back in and try it again. And it goes to show how it's like the one problem is the car won't start and there's 4 different potential solutions.
Oh, yeah.
I may have a patient come to me for hip pain and you have a patient come to you for hip pain or it's the same person. And you're like, oh, I think this is off. They're inflamed here, here, and here. You provide them either nutrients, pharmaceuticals, like whatever you'll do, and they get solutions. I'm like, oh, we need a dry needle this and then do this and I get solutions. Like, so are we both right? Are we both wrong? Are we both solving the same issue in our own way? And I think that's what's like, to me, just super interesting how we could potentially both see the same problem, diagnose it maybe a little bit differently, and still yield a solution. So then it's like, okay, so there's like a shared benefit, or there's 2 ways to solve the same problem, or like what's going on there. And that's what I think is ultimately just fun.
I think, and that's why I always take the ego out of it. I don't cure people. I try to provide the right environment for the body to cure itself. So it very much, and I know we've talked about this too when we first met, but this is where it really requires on the patient participation, the patient buy-in, and consistency.
Yes. And I think a lot of patients aren't used to that. Like the times that I will ask a patient, like, what do you think is going on?
Yeah.
They're like, I don't know. You're the professional. I'm like, you're the one living in your body.
Yeah.
I'm never that snarky back, right? But it's like, but I'll ask them that. You can tell it throws them because they're not used to that. They're not used to having a say or their opinion being welcomed in that room.
Oh, definitely. Yeah.
Told or like, oh, no, here's the problem. Here's what we're going to do. And I'm like, no, I need your participation. Like, or I'll be like, what do you think is going on? Or like, do you feel like this is helping? Or like, what have you Googled that has resonated like with your symptoms? And sometimes that is like a gold mine on giving you more answers than you asked for in a great way.
Oh, definitely. You get to find out where their thought process is, kind of what their buy-in is, all of that.
Yeah,
so it's absolutely
their injury or problem or whatever that may be. Okay. To finish out, I know you have something coming up. I believe you called it Check Your Health. This is something that Riordan does once a year, twice a year?
Twice a year. So it's biannual, typically in March and September. So
what is it?
We have a ton of different lab panels. This is, I believe it's 5 or 6 different lab panels, 6 different lab panels that will be heavily discounted. Essentially, you come and get the family and friends discount. It's about 45 to 50% discount on each panel. And I will say the mega panel itself, which is pretty much everything we can test from a blood standpoint, even urine, it's normally roughly around $4,500 out of pocket. With the discount, I believe it's around $2,200. So it's a significant discount. And it's a way for people to kind of get their foot in the door and literally check their health and see where they're at. February 26th, the Riordan Clinic is actually going to be hosting a lunch and learn about this. It'll be from noon to 1. And I believe we'll have it here, but more information as far as marketing will come out, I believe, next week about this.
Just a day or two probably after this podcast is released. So
yeah, actually. So perfect. So yeah, definitely check out riordanclinic.org. There should be some information as far as when that lunch and learn will come out. But ultimately, what Check Your Health is, it allows people to get in a little bit of a lower price point. No real complaints as far as, are you wanting to see a doctor for certain things, but we do offer a free 30-minute consultation with the top 3 lab panels that we're discounting as well. So we'll kind of go over all of that information in that Lunch and Learn, and all of that information will be up on our website soon.
On the Lunch and Learn, does that cost?
I believe it's free. I believe you can register and then we'll have a lunch, but don't quote me on that just yet. I think we're still getting some logistics and everything figured out for all of that, which I know we're kind of running into February already, but that's how it always happens.
Oh, for sure. Like we talked about before we got to recording, it's all about urgency, right?
Yes, absolutely.
Okay, cool. So I think for a lot of people, I think this is going to resonate with a lot of you. And if you're listening, you're like, wow, I think this is what I've been looking for, or my mom or my cousin, my sister, my friend, whatever needs this. If it seems a little intimidating, 1, just go check out their website. I'll have it down in the description below. But 2, if you want to, like we talked about, kind of get your feet wet, come in and just see what the place is about. Come into the Check Your Health thing, or even just get started with this Lunch and Learn. I know one of the ways that we do marketing is workshops and things like that, because again, we do things differently.
Yeah.
And I think people want this, but it's intimidating to step outside the box. And so if you can come and just like see the facility, meet Dr. Rose, meet some of the other people here, get a feel of what they do and what that feels like, I think that's a great place to start. And then if you want to go and get those lab panels, like you said, those will be discounted. Will we, as the people coming in, pick our panels? Do we ask what you think we should have? Like, what is that?
You can pick your panels.
Okay.
So when you call, you make the appointment and you let whoever's taking your information down what panel you want.
Okay.
Because then they'll put you on the lab schedule and let you know when to be there and everything, whether you need to fast or not, that kind of stuff. But you get to choose which panel you want to do.
What are some suggested panels for the average person that may be coming in? Or what are some examples, multiple choice, to kind of pick from?
So off top of my head, the top 3 are the advanced wellness, which is going to be all of your basic labs, but also including some of the major vitamins and nutrients and fatty acids. I actually had my parents do these in September and got quite a bit of information on them. Helped them with some supplements, and my mom was able to lose, I believe she said 10 pounds in the first 2 weeks just by getting her inflammation down.
Body's working appropriately.
Yeah. I mean, and it's just finding out what's going on underneath.
Mm-hmm.
The nutrient panel is the second to largest. That's going to be all of your vitamins, all of your amino acids, minerals, and I believe fatty acids as well. The mega panel is going to be basically the nutrient panel plus all of the hormones. We do have a basic panel. We also have a hormone panel where it's just the hormones. So prices are the range of prices for all of these panels is pretty large. We'll have some actual printed literature and digital literature for you guys to check out here shortly.
Cool. So if somebody is driving right now and they don't have the ability to like Google this, what's something that you can tell them on how to get access to the Check Your Health? Should they just go to riordanclinic.org and you guys will have the Check Your Health information there?
Yes, it'll be there. You can also give us a call at any point in time. Our front office is great at kind of explaining what it is and how to get started with it. It will be the first 2 weeks of March. So that's when that will be. And then, as always, the Lunch and Learn, those are all recorded as well. So if you cannot attend the Lunch and Learn or you cannot log in on the day of and watch it live, it will be recorded and you'll have access to it on our website as well.
Gotcha. So the Lunch and Learn will be digital, not here in person.
It can be both.
Okay.
Actually,
cool.
Yeah.
Okay, fantastic. Well, I'll make sure I do a good job of putting all this in the description to make it easy for you. I really hope, and I do believe you will, grow this clinic to what you want it to be. And I think it'll just be a slow, steady process. And hopefully this can help speed it up for you. And hopefully we get people in and supporting these types of businesses so that we can get them to grow. Because I think it's creating the medical system that we really, truly want. And it's fun to have a place like this here in Wichita, especially because it started here and there's a lot of cancer research behind it.
Yep.
So we covered a lot here, Dr. Rose, and I appreciate your time. I also am excited about learning more and continuing to build this relationship and help more people in the Wichita area and even people within a couple hours of here that may want to travel and come check you out.
Absolutely.
Is there any other parting thoughts, any things that we didn't cover that you wanted to mention one more time, or just any part of parting information?
Just last minute thoughts on that, what you just said. I think the important part about moving Riordan into the next 50 years, because we did just celebrate 50-year anniversary last year, is very much developing partnerships with people like yourself to have the same mission and really trying to change the system for the better. That's ultimately what is going to preserve places like this for another 50 years.
Yeah. Because if we don't, then they're going to kind of fade away and we'll just go back to corporate medicine.
Oh, yeah.
Which is clearly not working.
It's not working. So
perfect. Well, thank you for your time. And hopefully today you learned a little bit more how to heal without harm.